Hello, this is your Congressman Michael Burgess. It's been months, but the disastrous rollout of Healthcare.gov this past fall is still fresh on the collective minds of the American people. The President spent much of last month celebrating having met the goal of enrolling over 7 million Americans in Healthcare.gov. These enrollment numbers are, in fact, too good to be true. And it is troubling that our repeated requests for briefings to learn more about the context of the enrollment numbers has been met with total silence by the Obama administration. We do need to know more. Who are these people? How many of them were previously uninsured? For a president who campaigned on a promise to insure the 45 million Americans who lack insurance, it is highly suspect that the White House has stayed mum on the issue of just who is included in this group. Thanks to the House Energy and Commerce Committee, we found out part of what they're trying to hide. Recent data submitted to the committee by every insurance provider in the new healthcare law's federally facilitated marketplace shows that 2/3 have paid their first month's premium. This is troubling. Further, news reports this week have shown that big important aspects of the federal exchange system are still missing in action, and there is no clear timetable for their completion. Questions remain about the automatic enrollment process and the transfer of billions of dollars, billions of tax dollars in premiums and tax credits. The Obama administration said this would all be completed last fall. Then they said January, then March. Now they're saying we can expect them to have it completed by this summer. But just because we've become used to long delays, a broken system, and an untrustworthy White House doesn't mean we have to accept it. The fact is, hospitals and doctors are the ones on the hook for the Affordable Care Act's failures. As a physician, this concerns me. A month after the enrollment deadline, it is clear that for those who were able to navigate Healthcare.gov, they did so reluctantly after being forced off of plans that they liked and trusted. Healthcare.gov's Facebook page contains a wealth of stories from people who say they are worse off now than they were before. Wendy said she is now unable to afford insurance for her 12-year-old son. Amanda said it took her months of wasted time to navigate a system that still doesn't work. Megan, a healthy 23-year-old, said she is contemplating foregoing insurance altogether, paying the fine, since her yearly checkups under the new law would be more expensive than they would have been with no insurance at all. As a physician in Congress, I am doing everything I can to make this president accountable and to ease the pain that this law is causing. As always, I appreciate your questions and your comments on the issue. Thank you for taking the time to listen. May God bless you and your family, and as always, may God bless Texas.